Every healthy body has a secret shield, a steady flow of cortisol that rises in moments of illness, fear, or stress. But in adrenal insufficiency, that natural defense is missing. So during sickness or stress, we must step in, giving the body what it can no longer make on its own. In this video, we'll learn how to protect that balance during stressful times, surgeries, pregnancy, and emergencies, so your body stays strong, calm, and safe, no matter what life brings.
Daily illness, emotional strain, and minor stress. Sick day adjustment. On normal days, your body keeps cortisol steady, rising naturally when you face illness, pain, or worry. But for someone with adrenal insufficiency, that natural rise doesn't happen. So during times of physical illness or significant emotional stress, the dose must be increased to keep your body in balance. If you develop a mild cold, low-grade fever, stomach upset, or even strong emotional strain, such as grief, panic, or intense anxiety, double your usual hydrocortisone dose temporarily. If you usually take 10 milligrams in the morning, take 20 milligrams instead. If your noon dose is 5 milligrams, make it 10 milligrams. Continue this for 2 to 3 days, then return to your normal dose once you feel stable again. However, for ordinary daily worries, mild tension, or routine mental effort, you don't need to change your dose. Your regular hydrocortisone already covers minor stress. If you cannot keep tablets down because of vomiting or severe diarrhea, inject 100 milligrams hydrocortisone intramuscularly right away, or go to the nearest emergency department. Drink fluids, rest, and give yourself time to recover, because both body and mind depend on cortisol for resilience. During sick days, increase only hydrocortisone and keep fludrocortisone, Florinef, at the same daily dose. Examples: requires dose increase, fever, flu, infection, food poisoning, dental extraction, panic attack, or severe emotional shock, grief, bad news, or major life crisis. No dose change needed. Normal work stress, mild anxiety, studying, or brief emotional ups and downs.
When to triple the hydrocortisone dose. Most mild illnesses only need a double dose of hydrocortisone. But in some situations, you may need a triple dose for extra protection. You may triple your dose for high fever above 38.5 degrees Celsius or 101.3 degrees Fahrenheit, moderate infections needing antibiotics, or severe physical stress such as intense pain or dehydration. You may also need to triple your dose for strong emotional shock, grief, bad news, or a severe panic attack, or when doubling the dose isn't helping. A triple dose is used briefly, usually 24 to 48 hours, until you feel better. If symptoms continue or if you're unsure what to do, consult your doctor for guidance. And if you start vomiting or can't keep tablets down, go straight to the 100 milligram hydrocortisone injection and seek medical care.
Emergency injection preparation. In an emergency, every second matters. Let's see how to prepare your hydrocortisone emergency injection. If you have a Solucortef Actovial kit, press the cap to release the liquid into the powder. Gently swirl until the solution becomes clear. Draw 100 milligrams into a clean syringe and inject it into the thigh or shoulder, even through clothing if needed. If you only have a hydrocortisone sodium succinate vial, Add 2 milliliters of sterile water or saline. Swirl gently until dissolved. Then inject the full 100 milligrams intramuscularly. If your vial is expired and no replacement is available, use it anyway, because the risk of not giving the injection is far greater than the risk of using an expired vial. Check the color and make sure there are no clumps or discoloration. Then head straight to the hospital for continued care.
Major stress and surgeries. Before any surgery or major stress, the healthy body increases cortisol to protect blood pressure and energy. In adrenal insufficiency, that rise doesn't happen automatically, so the dose must come from outside. Major stress means more than surgery. It includes serious injury or accident, childbirth or heavy bleeding, severe infections like pneumonia or sepsis, intense emotional or physical shock. In all these, hydrocortisone 100 milligrams IV must be given immediately, followed by 50 to 100 milligrams IV every 6 to 8 hours for the first 24 hours, then gradually reduced as recovery begins. Once stable, you'll return to your usual oral dose. And most importantly, your medical team must always know that you have adrenal insufficiency, especially in the emergency room or operating theater.
Dental procedures and minor operations. Even dental work can stress the body, especially extractions, deep cleaning, or gum surgery. For routine cleanings or fillings, no dose change is needed. But for procedures that cause pain or anxiety, double your usual hydrocortisone dose on the same day. For bigger procedures like tooth extraction or oral surgery, take hydrocortisone 100 milligrams IV or IM just before the procedure. Then taper back to your regular dose once you recover. If pain or swelling continues, your doctor may keep the higher dose for another day or two. Always make sure your dentist knows about your adrenal insufficiency to avoid medications or anesthesia that could lower your blood pressure.
Pregnancy with adrenal insufficiency can be completely safe as long as your treatment is consistent and carefully followed. Both hydrocortisone and fludrocortisone are safe during all stages of pregnancy. If needed, prednisone can also be used, but dexamethasone should be avoided. It can reach the baby in higher amounts. During the last 3 months of pregnancy, your body faces more stress and needs extra cortisol. Your doctor may increase your hydrocortisone dose by 5 to 10 milligrams a day. During labor, hydrocortisone 100 milligrams IV should be given at the start, then gradually reduced after delivery as recovery begins. After birth, return to your usual oral dose once you feel stable. And yes, breastfeeding is safe and encouraged because hydrocortisone passes into milk in only tiny, harmless amounts. Pregnancy is a time of strength, not fragility, and with the right care, both mother and baby can thrive in perfect safety.
Always be prepared. Always carry a medical ID card or bracelet that says Adrenal Insufficiency, needs hydrocortisone in emergency. Keep your emergency kit in an easy-to-reach place with spare syringes, hydrocortisone vials, and saline. Teach at least one friend or family member how to prepare and give the injection. A few minutes of training can save a life.